Right, you're just in time for the live show of Monday Report Town Hall session live from the Park Inn by Radisson in Westlands. This night, we're talking about the burden of healthcare. Do you know your rights as a patient? Well, the Charter of 2013 Patients' Rights clearly stipulates Part 2 that any patient has the right of seeking healthcare irrespective of whether they can pay for it or not. What do we see instead? Thousands of patients detained in hospitals with bills that continue to accrue. Some of them take very drastic measures to get out of hospital. Tonight, we find out from the stakeholders and also listen to the patients and see whether we can come up with an alternative. I'm not alone as usual. Mashirima Kapombe, mambo vipi?
Mambo poa Trevor, kama kawaida, lakini kwa leo mambo ni mawili. Kwa upande mmoja kuna hilo swala la kuwa mgonjwa ana haki ya kupata matibabu. Kwa upande mwingine kuna hospitali ambayo inahisi kuwa haitoi hayo matibabu bure. Kwa hivyo watafanyaje kuhakikisha kuwa deni lao pia linalipwa? Tutakuwa tunapata majibu hayo hapa tu, na pia kupata maswali kutoka kwa wale ambao wameweza kupitia changamoto na mahangaiko, haswa sio tu kwa wagonjwa bali pia kwa jamaa zao ambao wanawachwa nje wakijua kuwa wapendwa wao wamepona lakini hawawezi kurejea nyumbani.
All right, let me introduce my guest to you real quick, beginning from my immediate left. That's Gilbert Osoro, Manager Benefits and Contracting at NHIF, followed by Angela Nguku, Executive Director, White Ribbon Alliance, followed by Dr. Jackson Kioko, Director of Medical Services, and last but not least, Dr. Swarup Mishra, Member of Parliament Keses, and also the Vice Chairperson, Health Committee in the National Assembly. We'll begin this rather differently. I'll pose this question to a lawyer who's also with us here. Charles Mado is the one who represented Murage, who had to take very drastic measures to get the child out of hospital, and he's seated with me here. And the first question to Mado is there any legal basis of holding a patient in hospital?
Trevor, there isn't a legal basis for holding a patient in hospital if at all there is no lawful court order directed at the hospital to hold that patient in hospital.
So what options does the patient have then, or in the hospital as well? Because the hospital would say that we are losing money by letting people go.
Well, the courts have faced this particular problem, and this is what the courts have said, Trevor, that the relationship between a patient and a hospital is a contractual relationship. So when a patient goes to the hospital, they enter into a contractual obligation with the hospital. One, that relationship is a rather special relationship because this patient is also guaranteed certain constitutional rights. The right to healthcare under Article 43, the right to dignity and humane treatment under Article 28, the right to freedom under Article 29 of the Constitution. And so if a hospital feels aggrieved by a patient who is unable to pay their hospital bills, they have civil remedies. Okay. You can refer the matter to court, right, and you get the patient either committed to civil jail, if that is an option that you want to have, or the hospitals are also encouraged to have dispute resolution mechanisms where, you know, certain patients who meet certain criterions are supposed to be given certain waivers. Okay. But the hospitals are, what is definite is that the hospitals are not permitted to hold patients arbitrarily.
So it is illegal?
It is illegal.
All right. Yeah. Let's pose this question to a government representative, Dr. Jackson Kioko, Director of Medical Services. Is the government aware this is happening?
Well, thank you, Trevor. Well, of course, the government is aware that this is happening, and we have had several cases of patients reported to have been detained in hospitals. It's happening. But again, we need to ask ourselves, why is it happening? Why are they being detained? And as the lawyer has put it very clearly, the institution, the hospital, has an economic obligations. They need to raise resources to be able to provide services to patients. But again, also the patients are right to access services. But let's look at it at this angle. Why is it that patients are being detained in hospitals? It's because they are not able to pay for their care. They are not able to pay for the bills. And why is it that they are not able to pay the bills? It's because the cost of healthcare in this country has been escalating, more so affecting that segment of the population that is not able to take care of its healthcare. When you look at it, Trevor, is that in this country that it is the high cost to individual persons who are then subjected to pay out of their pocket, which they do not have, resorting to even to subjecting them to financial burden and even catastrophic crisis. And this is the situations we are having. It's not that they are able, their ability to pay is not there.
But isn't the government obligated to elevate that weight of healthcare, so to speak?
Well, and that's why, Trevor, that the government has realized that this is a challenge. And then it has come in now into this space through now the universal health coverage to be able now to address this segment of the population that is not able to pay, to be able to make sure that at least this population is covered, it is cushioned from these catastrophic expenses.
We'll talk about the UHC in just a bit, but let me bring in Dr. Swaroop Mishra here. You sit as a vice chairperson of the Health Committee in the National Assembly. What are the solutions to this particular issue? Is it even a priority for the members of parliament and the committee?
First of all, good evening, everybody. I will talk not only as a vice chair and the MP. I'm also a consumer as a patient. I'm a doctor, a hospital owner, and also not only Kenya but East Africa, and also a member of parliament and vice chair, and also I was a health educationist in Moi University. Now let me tell you, I support and do agree. It is very illegal to hold the patient soon after the discharge, because a patient, healthy human being, should not be held in a hospital premise, because it will make the patient again unhealthy. Because there is hospital acquired infections are there is psychology element is there are a lot of things are there. To treating patient is not only physical, it's also psychological as well. Then somebody you are keeping in the patient after discharge means you are exposing the world, he is socio-economically deprived. So it's another psychological insult and insufficiency you are telling the world. So it is illegal, number one. Number two, but I let you know, it is a problem now, challenge. It is an issue that why hospitals also detaining. You know, if we want to solve the problem, we have to amicably listen to bilaterally. If you don't solve bilaterally, no problem is solved. Am I correct? So number two, the Ministry of Health should invite all the hospital private sector to a meeting, how to solve it bilaterally, so that no patient from tomorrow will be in this republic will be withheld in any premise of hospital.
So you think
Number
there should
one.
be a meeting?
Yes.
Okay.
Number two, why people are going to private hospital? There are three types of patients. Patient, which is emergency accident, which they don't know, they are not conscious, but they have to save the life. We want to take the patient to the private hospital.
Okay.
Let me tell you, whether the patient has money or not, it is human. Any hospital, private or public, if he has no money or yes money, we have to treat.
Okay.
Then after stabilizing the patient, maybe you will ask the patient to refer to the public sector is another thing. Number two, type of patients. There is, again, the patients are elective, but two types of patients. The patients which have no facility in the public sector, but private sector has that facility. That is one type of patient. Another type of patient is the both public and private sector is the patient.
All right.
So in this case, we have to enhance the quality of public sector so that nobody will go to private sector. Who doesn't have money cannot go to the private sector. Who has money, will go to the private sector.
Okay.
So that way.
Hold that thought in just a bit. Angela and Gilbert, I'll come to you in just a bit. But let's find out from Mashirima what the questions are from the audience now, because they have a lot of concerns concerning this issue. Mashirima?
hospitali za kibinafsi, lakini hivi majuzi tumemwona Boniface Murage kutoka hospitali ya umma ya Kenyatta akiwa anajaribu tu kumtoa mtoto wake kutoka hospitalini. Boniface, hujambo? Simama tu kidogo, tueleze ulipanga siku ngapi kabla ya kumuiba mtoto wako kutoka hospitalini?
Nilikuwa nimeenda kama siku 5 hivyo, na venye nilikuwa naenda nilikuwa naona bado biru ilikuwa inaongezeka. Nikaona tu badala iongezeke tu itahili tu niwasaidie tu familia yangu, juu pesa sigi afford. Juu the more than natafuta do, the more biru inaendelea kuongezeka.
Na mama uliona utamtoaje? Maana mtoto ulikuwa rahisi, ulimweka kwenye mkoba na ukatoka.
Mama nilimwambia tu anifuate nyuma.
All right.
Trevor?
And this comes directly to NHIF. The Boniface, I was wondering from Boniface Mashirima, iwapo alikuwa na NHIF na anaelewa NHIF vile inavyofanya kazi kweli?
Kama ulikuwa na kadi ya NHIF?
Kadi ya NHIF sikuwa nayo kwa ajili, sikuwa na uwezo wa kukata hiyo kadi.
Na saa hizi uko nayo? Umejaribu kujisajili?
Sasa hivi niko nayo.
Okay.
Trevor?
Gilbert, this comes directly to you. How do you cater for the population like Murage was there, who say that they may not be able to pay for NHIF?
Thank you, Trevor. Good evening. At NHIF, we have a comprehensive package for maternity cover, which is popularly known as Linda Mama. And we also have, under the national scheme, the maternity package, whereby we do cover our members. I know I'm acutely aware the case of Boniface, where he took his 1.5-year-old daughter to Kenyatta National Hospital for referral treatment. At the point of admission in Kenyatta National Hospital, Boniface was not a member of the National Hospital Insurance Fund, as is alluded. The scriptures tell us that my people perish because of lack of sufficient knowledge. My appeal to Kenyans this evening is kindly take time to subscribe to the packages that NHIF has rolled out by becoming a member of NHIF.
What if they simply cannot just afford it?
The government has put into place mechanisms to cater for Kenyans who cannot be able to pay for the NHIF subscription. When the Jubilee administration came to power, they promised to roll free maternity cover, popularly known as Linda Mama, and it's being administered across the country. Joining is free of charge. You can join either by visiting the nearest NHIF offices, and for that matter, we have offices across the country in 47 counties. We've also set up offices across Huduma centers, whereby you can just walk in, produce your ID, and register. Finally, you can also register at the point where you're accessing services, that is, either hospitals or maternity and nursing homes, to be a member of NHIF. Okay. You can also register through your mobile phone by dialing *263#. It provides a platform for you to register to be a member. NHIF recognizes that you can use mobile telephony to be able to register to be a member of NHIF.
Okay. Angela, you've been dealing with people on the ground and you've had their complaints and you hear the explanations from the government as well as NHIF. What is the experience you had out there? And is this sufficient explanation?
Thank you so much, Trevor, and my fellow panelists and the audience. I must say that trespassing almost the 47 counties, the issues are different, the context is quite different. But one thing is for sure from our perspective, because we've been speaking to women and families across the country, where we've been listening to their voices, and one of the things that they will tell you is that they are financially they are not able to afford, number one. Number two, there are so many cases of disrespect. And one of them is detention that we are talking about, in the case that we just saw last week. So I must say, as much as I know the government has been working hard to address a lot of these issues, the majority of the population are yet to get there.
So it's not a matter of lack of knowledge, it's simply that they cannot afford it.
It's a combination. Because if you look at the way, for example, the NHIF Linda Mama project is being rolled out, there's a lot of advertising on different channels. But let's look at how does it reach to that person in the farthest part of Lamu, for example, in the farthest part of Samburu, for example, Baragoi, in West Pokot, in Suba, somewhere in the islands, in Rusinga Island and the like. So we must think of how then do we ensure that the common citizen, the common Kenyan understands how to get there. And the other thing, Trevor, what we've realized is that most of us Kenyans as citizens, we do not even understand what that means and what our rights as to what that implies. What is my role? I know the government has said this, but when I go to the health facility and this is not being given to me, what am I supposed to do? So it's a whole complex issue. At the national level and at the central places, it looks like it's very okay. Yeah. Everything looks like it's going on well. But until you get to the grassroots and really get the issues and listen to those people who don't even understand, some of them tell you that they are not in this. How is Kenya? Yeah. That tells you that there's still need for the people who are rolling out, whether at the ministry level or at the NHF level, to basically just reach out and be able to get to that common mwananchi.
Alright.
Yeah.
Mashirima, kuna maswali naona ziko mingi kweli.
Naam, hapo Bwana Osoro ametaja kuhusiana kuwa NHIF inastahili kulipia mambo kadha wa kadha, lakini Jacinta na swali kuhusiana na malipo hayo yanafanywa kivipi? Jacinta, simama tu kidogo tafadhali.
Okay. Swali langu ni hili. Kwa nini NHIF inalipa upande mwingine na ingine ilipi? Kwa sababu gani? Ukinilipia nusu na hii nusu ingine siwezi kulipa, itabidi nikae tu hospitalini. Kwa nini wewe silipa bilu yote ikiwa mgonjwa amegojeka?
Osoro. That is directly concerning NHIF.
Asanti sana Jacinta. Ningelipenda kuelezea Wakenya hivi. NHIF imeweza kuandikisha kandarasi na hospitali tofauti. Kuna hospitali za serikali ambazo ziko kwa contract A, that is government facilities. Tuko na contract B, faith-based institutions and low-cost private hospitals. Na mwisho C, ambazo ni hospitali za kibinafsi. Ukiweza kutembelea hospitali za serikali na zile za kidini ama faith-based institutions, utaweza kutibiwa, ulazwe na urudi nyumbani bila kulipa chochote. That is walk in, walk out without paying a single cent. Lakini ukiweza kuenda kwa zile hospitali za kibinafsi, private hospitals in contract C, na hizo utaweza ambiwa uongezee ada kidogo zaidi ya vile NHIF itakulipia. Nafikiri tuko na pamoja na madam. Katika hospitali za serikali na zile za kidini ambazo zimeandikisha mkataba mwafaka ama comprehensive health cover, hauwezi kulipishwa hela yoyote.
Sijaridhika. Kwa sababu gani? Hata nikiwa kwa hiyo hospitali ya serikali, iko wakati bilu inafika inakuwa juu. Wanasema wanalipa nusu na mgonjwa alipe nusu. Kwa hivyo sijaridhika.
Kwa nini wanafanya hivyo, Bwana Osoro?
Angela, I see you want to jump in, but let Osoro finish this. Then we'll also bring in Dr. Jackson as well.
Asanti sana. Manake hospitali za kiserikali, jinsi nilivyosema hapa awali, tuna contract mwafaka ambapo ukitibiwa utalazwa, ukule na upewe dawa uweze kurejelea nyumbani. Kitu ningelipenda kuelezea Wakenya kwamba kwa mfano ukielezewa uweze kuongezea hela, ni afadhali uweze kuwasiliana na ofisi ya NHIF iliyo karibu nawe ili waweze kufanya uchunguzi, wajue mbona unalipishwa hela zaidi. Na kusema kweli, ile mkataba tumeandikiana, kwa mfano upasuaji ama kwa lugha ya kimombo surgical package, tumeweza kukaa chini na hospitali na tukaweza kuelewana ile bei ambayo sisi kama NHIF, bima ya kitaifa hospitali, tutawalipa kwa kufanya upasuaji, na hiyo hela inatosha wewe kulazwa na kupewa dawa. Pengine ilikuwa kesi moja, na ningekuomba baada ya show uweze tukae chini uweze kunielezea ni wapi ulipata matibabu, tuweze kuangalia jinsi ya kukusaidia.
Alright. Angela, you want to jump in?
Yeah, thank you, Trevor. You see, Jacinta's question,
yes.
Jacinta's question is a question that we have had across border.
Yeah.
And the issue is not just about having to pay half of the money, but also being in that health facility and being told go and buy such and such and such an item to come to the health facility. So you go to that health facility and the let me talk about the women that we deal with, the pregnant women and the girls. And they tell you that we were taught to go and buy gauze, we were taught to go and come with such and such surgical blades and the like. And you're wondering, so if NHIF is really covering everything and this is catered by the government, then why are we subjecting our clients to more burden when they go to those health facilities? That means the health facilities are not stocked enough to be able to respond to the needs of these people. Then the other thing is about the bureaucracies in what Mr. Osoro has just talked about. It's not that easy. When clients go for NHIF, I'm telling you, like, they will be told, it's a bureaucratic process. It's really long for someone who is actually sick and having a patient. And some of these times, these clients do not have people taking care of them because it's an extra burden of the caretaker having to take care of themselves. Yeah. So how do we then ensure that, how does NHIF come in to ensure that they'll alleviate the bureaucracies that are there to ensure that it's a seamless process and clients are not kept on waiting for come back tomorrow, we have to contact NHIF, the application is not working. How do we get out of this so that we can actually ensure that we enjoy services without having to face all the difficulties that we are seeing?
All right, Dr. Jackson, this is coming to an issue of resources.
Just allow me maybe to say a few things. One is if we had better managed public health facilities, the issues of non-availability of commodities, including the non-farm, would not be an issue. If the resources that are being reimbursed to these facilities were used prudently, then we'll be able to have the best of the commodities for patients to be able to use. You will not be told this is not available, this is not available. But Trevor, allow me to comment about the Linda Mama issue, because I think it's something that Kenyans need to know. The Linda Mama, it's a government program that ensures that pregnant mothers are able to access services from the time you conceive to the time your child is born and is 1 year. You should, and Kenyans should take advantage of this. Would the government ask resources to take care of this? Men who have pregnant women, I challenge you, this is an opportunity. Your wife becomes pregnant, you just make sure you get registration, she'll be able to access services all through until the child is 1 year. It is possible. It is happening in both the public facilities and faith-based institutions. The government is taking care of this. The case of Murage, Trevor, there are so many Murages who are out there. But many of the patients have just absconded. They just absconded from the facility. But the issue here is that I would want to urge patients not to abscond, because institutions have mechanisms that will ensure that there is an engagement to have the settlement of the bills in a more amicable way. We always insist that if the fees are not waived, that there must be a financial arrangement, a credit facility that should be extended to these individual patients or the families and release them. And as Mheshimiwa said, it is actually not socially acceptable.
But this is not being adhered to, even in hospitals. They don't give them those options.
I want to tell you that
a patient actually jumped off and committed suicide.
It is happening, and I want to attribute this to some communication breakdowns. The institutions ought to communicate and provide the necessary environment for negotiation, for agreement, and to be able to understand who is not able to pay, who is able to pay.
Okay. Dr. Swarup, you want to jump into this very briefly?
Thank you. We have to, information is power.
Yeah.
We have to make blueprint in vernacular language and Swahili and English to each and every citizen of the Republic. What is going on now? In the health, what is universal health coverage, what is Linda Mama program, what are their rights, what is NHIF doing. If they are not informed, how they will know? So, and when they are informed, everybody, the health workers and providers for both public and private sector will be careful. Number one. Number two, we have to make a strategy, which we are coming up, and thank to Ministry of Health and also Health Committee, that we are centralizing the supplies, which is very good. Okay. And let me tell you one thing, Rome was not built in a day, but it was built. This is our country. This is our country. We have to also sacrifice kidogo, 6,000 shilling per year. Even we will allow you 500 per month, Kenya shilling. We will go reach there. Well, there is a will, there is a way. Nothing is free. Somebody has to pay. Am I correct? So this 6,000, please, NHIF is doing a great job. I never seen even developed country what NHIF they done in last 4-5 years. Thanks to the leadership and thank to God.
But it's not being felt on the ground. By the
It is coming up.
Yeah.
Let me tell you, as last year, 176,000 patients in dialysis done through NHIF. 11,000 surgeries, major surgeries, were done free. Both specialized, mediocre and minor.
All right.
50 billion Kenya shilling they are getting now in a year. Am I correct? But it is now surpassing. 106%. This is 52 billion. So let me tell you, one day will come, we will reach there. But it is tough, but we have to also know that more enrollment of the of our citizens will be very good. It will empower the NHIF and it will empower ourselves in health.
All right.
Number 2, last one.
Very briefly, yes.
Very brief. The people who are more socio-economic, can we increase their fees for NHIF enrollment? And the people who are also employers, they should also contribute to the people, to the employee. Thank you very much.
All right. Bashirima ni kama pia hospitali zinakiuka sheria kidogo, manake wanasema they should actually inform the patients that they have rights, but they're not doing that.
Naam, lakini hapo ndio hospitali pia zitaweza kujitetea na kusema kuwa lazima zile pesa ziweze kurudi ili waweze kuendelea kuwa tibu wagonjwa wengine watakaokuja. Lakini pia kama alivyosema Daktari Mishra hapo kuhusiana na kuwa zile pesa watu wanachanga ni mtu tu kujifinya, lakini wengi hapo watahisi kuwa hata hiyo 500 bado ni pesa nyingi. Tunapumzika kidogo, tutakaporejea tutakuwa tunapata maswali zaidi kutoka kwa wale ambao wamefika hapa. Usiondoke.